Smarties, today we are so excited to welcome Integrative Psychiatric Nurse Practitioner Sara Langley. Today she talks to us about what Integrative Psychiatric Nurse Practitioners do, how nutrition works in tandem with medication, and why it's beneficial to look at the whole picture of a learner. She also provides so many easy, simple tricks and tips and recommendations that can have a tremendous impact. And what's wonderful is you're probably already doing some of them. Smarties, if you want to support the work that we are doing here on the podcast, please head over to our Patreon. For a simple $5 a month donation, you get so much. You get free access to early episodes and extended conversations that we have with the wonderful guests that join us on this podcast. That link is www.patreon.com/LearnSmarterPodcast. Let's dig in.
You want to learn faster, but sometimes working harder is just not the answer. You have to learn smarter. The Educational Therapy Podcast.
Hi, Smarties. Welcome to episode 366 of Learn Smarter, the Educational Therapy Podcast. I'm Stephanie Pitts.
And I'm Rachel Kapp.
And today we are thrilled to have Sara Langley, who is an integrative psychiatric nurse practitioner with us. And she's going to be talking about ADHD and nutrition. And I'm so excited. Welcome.
Thank you so much. I'm happy to be here.
I'm ready to learn.
I'm so excited to have this conversation with you. I know we talked about it a long time ago, so I'm so happy it's finally happening. But before we sort of dig into everything, can you introduce yourself to our audience and share a little bit about who you are, what you do, your background?
Of course. Thank you, Rachel. So my name is Sara Langley. I'm an integrative psychiatric nurse practitioner, founder and co-owner of Childkind Integrative Psychiatry in Beverly Hills. I also have my very own blog site, Mommies in Mind, where I share, advice and information for moms pertaining to neurodiversity, so autism, ADHD, as well as both medication management, as well as nutrition and supplementation to support children.
Fantastic. And obviously, Sara, you have an accent, so can you share a little bit about where you're from?
Of course. I'm from London, England, but currently living in Los Angeles.
Perfect.
And do you do in-person, virtual, both?
I do both.
So let's start with the basics. Assume we know nothing. Can you please explain what an integrative psychiatric nurse practitioner does?
Of course. So an integrative psychiatric nurse practitioner, integrative psychiatrist, essentially we are looking at the patient as a whole. So instead of just prescribing medication and sending people out the door, we're going to look at things like lifestyle modifications. So sleep, exercise, of course, nutrition. So I'm certified in nutritional psychiatry specifically. So nutrition forms for me a very important component of the visit. So we talk about what the child is eating, what their specific food aversions are, and then any deficiencies that we think might be at play, and supplements specific to the condition we're treating. So supplementation specific to ADHD to help the ADHD brain kind of work at optimal functioning.
Okay. So can you explain the connection between nutrition and ADHD symptoms?
So for ADHD, we're typically running low in both norepinephrine and dopamine. The brain makes norepinephrine and dopamine from building blocks. Those building blocks are micronutrients as well as proteins, macronutrients that you may be taking in. So in order to support the ADHD brain so that it's able to make, a sufficient supply of both dopamine and norepinephrine, you need to give it all the supplies that it needs. So you start off with a protein. The protein forms the backbone for the norepinephrine and dopamine molecule. And it's conveyor belt, essentially, conveyor belt from the protein all the way along to the brain chemicals at the end. And along the way, you are inserting all of these micronutrients. So, you have your B vitamins, you have, vitamin D, iron, zinc, vitamin C, in order to get from the amino acid to the final product, which are your brain chemicals. So this is supportive. I'd say anecdotally for families who are interested in this approach, that, you may see, for example, like a 20% improvement, which isn't zero, it's something, but obviously it's not as robust as, a prescription medication. But for whatever reason, some families may not want to start there. They may want to start here, see what they can squeeze out of a nutritional approach first before, reaching for the heavy hitters.
So you say it can be up to a 20% benefit, which is not insignificant, right?
Right.
How long does it take?
Sure. So it takes a couple of months. So it can take anywhere between 2 to 3 months to really see any sort of improvement with the nutritional approach. So it's the long game for sure. And for some families, that's a possibility. So for some families with younger kids, where there isn't as much at stake, they have the summer off, grades aren't as important at this point, they can experiment and try out different nutrient trials, try out different supplementations to see if this helps with symptoms. But typically for the older kids coming in, where there's more at stake, they have SATs around the corner, maybe college is looming, they might need a quicker fix, and maybe they can't necessarily wait that 2 to 3 months to see if the nutritional approach is going to give them the results that they need. So at that point, you would marry, a low dose medication with the nutritional approach. So a combination of the two together, which is what I do in practice.
What is the efficacy of both together?
It's better than either on their own. So, for example, if a child has a zinc deficiency, for example, improving zinc status within the body can help us keep the dosage of stimulant lower than it would otherwise normally be. Combining a probiotic with a stimulant medication as well is more effective than just using the stimulant on its own, more effective than just using the probiotic on its own, for example. I think the same is true for omega-3 works synergistically with medications, so you get more oomph out of the medications that you're using. So the combination of the two is more powerful than either alone. So that's what I try to encourage.
So you like to look at the combo. How do you figure this out? Is it a blood test? Is it like a history of what they're eating? How are you doing this? What happens?
So in terms of figuring out a child's nutritional status, we do an in-depth history. So we take a food diary just to give me a glimpse of kind of what is this kid eating day to day. So for example, a lot of kids, avoid vegetables, for example, which is unfortunate because vegetables have a lot of the micronutrients that are needed for that conveyor belt from the amino acid protein all the way to the dopamine and norepinephrine. So we're trying to see, where could deficiencies potentially be lying? Do we need to use a multivitamin to kind of fill in the gaps? You can also do hair mineral analysis. So the parent takes a sample of the hair, sends it off to the lab will analyze it to see, what are the chronic long-term deficiencies for this child, if any?
That's cool.
It is. And it gives us a 3-month shot of what is potentially running low.
Like a history.
Exactly. Blood tests are okay, but blood tests are kind of they give us the information in the moment.
Yeah, snapshot.
Yeah, doesn't look far back enough, which is why I like hair, and also hair for kids, less invasive than poking with a needle.
Well, I want that.
Yeah, that sounds great.
So it's the combination of taking that history, doing testing, whatever that testing looks like, and then kind of using all that information to build a very specific, supplementation, nutrition plan for the child that's going to help their brain out the most.
Wow.
I love that.
This is really informative because I do have to say I felt skeptical about the nutritional approach, but just hearing what you have to say, because, there are a lot of families that will do the nutritional approach on their own.
Right.
And so what do you kind of say in those instances where, for example, they're like, my learner's ADHD is more prevalent when they have dairy in their diet, but this is all anecdotal and it's all just their ideas as opposed to going based off something that is research-based in conjunction with a professional?
Sure. My goal is to empower parents. You know your kid the best. If you're giving them something, whether it's dairy, whether it's gluten, obviously we know red dye 40 is terrible.
Yeah,
if you're
right,
giving
yeah.
them something and you're seeing a response, seeing a reaction, a behavior in response to that food group, that's information. That's telling you something is awry. For sensitivities, those are tricky to pick up compared to a true food allergy. A true food tolerance is easier to diagnose, to test for, whereas the sensitivities are tricky. It's kind of gray. When the results come back, it's kind of like a maybe, maybe not. So for that, I like to, again, empower parents to keep an eye on the child and to watch for any changes in behavior in response to a particular food group that they're eating, and do the elimination diet, obviously under the guidance of a doctor, because we don't want to go too far the other way where the child is now not getting any calories, adequate nutrition, which could impact brain development, impacts growth, and could impact just quality of life in the long run. So this all should be done under medical supervision with a pediatrician on board. And you can test out certain food groups. You can see what the reaction is. And you can, obviously keeping a diary along the way to note things and then bring that information back to the pediatrician who can then provide further guidance. But the food sensitivity, the food intolerances, it's tricky. Sometimes the results are not very clear cut.
That I get.
Off record, I was just at an allergist, and Steph, I think I told you this. We were talking about just testing. I was getting like random hives. It was like very unusual for me. And he said, we're going to do some allergy testing. And I'm like, oh, you're going to test food? And he goes, no. It's really inaccurate. Yeah. It's going to come back and say you're allergic to broccoli, but you had no idea you were allergic to broccoli. And it doesn't mean you're allergic to broccoli. It's just how he's like, it's 50% wrong.
Yeah, it's messy.
Oh, yeah. It says that I don't have a gluten issue when I did it.
Yeah, you do.
Yep, so you do, right? Yeah.
I want to know, what are some of the common nutritional deficiencies that you see with kids that have ADHD? Like, what are the common things, or what are the things that you see often that we wouldn't think about?
And then also, is it different for kids versus adults? Like, how does it change as they grow?
In terms of the deficiencies in kids that you might see, I haven't seen any severe deficiencies, right? Because I'm in Beverly Hills, everybody's very well nourished.
Yeah.
I've read zinc can cause or at least worsen any existing ADHD symptoms. That's a really good one to correct. Because when zinc is low, copper is high, and copper can exacerbate symptoms. Those two have an inverse relationship. Vitamin D, even when I was working back in primary care many years ago, everyone coming through the clinic door was deficient in vitamin D, which is crazy, especially for California, where there is so much sunshine. But we're not in the sun. We're indoors. We're in our cars. We're going from building to building where we don't have that sun exposure. And low vitamin D has also been, linked to anxiety, depression. Vitamin D is an important step from the conversion of dopamine to norepinephrine. So for kids who, have that issue with inattention, lack of focus, they're running low on norepinephrine. So you want to give them kind of like a good amount of time outside, direct sun onto the skin, no sunscreen, for example. So iron, when iron is low, that can cause symptoms that kind of mimic ADHD, so the fatigue, the low energy, kind of a lack of focus there. So iron is a good thing to test, and not necessarily to supplement blindly. Like, you should always test for iron before supplementing. The same with zinc. Like, don't supplement blindly for zinc, because if zinc is satisfactory and you are pushing zinc levels up, you're going to drive the copper levels down, and that's going to cause its own problems.
I think it's really important that you almost say that again, to not do this without the guidance of somebody. The things that you're talking about today are not recommendations for parents to go and try without guidance. Okay.
Exactly. This is for you to take to your child's healthcare provider to have a discussion and to do it under medical supervision. And obviously, like, for any parents who feel that their pediatrician is not that way inclined, or maybe not be well versed, then you can seek out more of an integrative pediatrician, or a pediatrician who has a background in nutrition. Like, there are options in terms of finding a more holistic provider for your child. And then between the adults to children, I don't have adult data because I'm capped at 18 or so. I don't get older than that. So I don't have enough kind of information to know deficiencies that run low potentially into adulthood. But I envision, if the diet is still an issue and there's impulsive eating and they're not necessarily reaching for fruits and vegetables, then you may see some of the same deficiencies. So, zinc, iron, vitamin D, things like that.
So what should a balanced day of eating look like for a learner with ADHD? And how different is it from a neurotypical learner who doesn't have ADHD?
So a diet for an individual with ADHD, whether they are or are not medicated, is going to include a high protein breakfast. This is so important. Specifically foods that are rich in tyrosine, because that is the building block, that's the backbone from which both dopamine and norepinephrine is made. Also, as proteins help with, just like energy stabilization, helps with growth and development of the brain, helps with tissue regeneration overall. So a very nice, dense protein breakfast, whether that looks like, breakfast sausages or, vegan options that are also high in protein. Eggs, I love eggs. Eggs are an MVP for me because eggs contain, B6, eggs contain tyrosine, eggs contain zinc. So that's a wonderful addition. Nut milks or, dairy milk, cheese. If you have like a cheesy omelet with vegetables, for example, oatmeal with quinoa and grains and, maybe a scoop of Greek yogurt on top with berries and a drizzle of honey, things like that. So start off the day strong.
That sounds so good.
I'm hungry.
Sorry.
And then for school time, lots of snacks. Because I'm finding that for the most part, younger kids are grazers. Like my son comes home with like a full lunchbox. I don't know why, but he picks throughout the day. So he gets adequate calories, but it's spread out over multiple meals over the course of a 12-hour period. So high protein snacks are going to look like hummus and vegetable sticks, or, again, mini muffins made with protein powder, or apple and nut butter, or edamame, things like that you can pack into small baggies and throw in the lunch bag. And then again, if a child is medicated, they may be skipping lunch. That's normal. If a child isn't medicated, you're looking for, like easy lunch items. So, a sandwich with deli meats and cheese, and then, a good portion of fruit, maybe a yogurt pot. And then when they come home, a balanced meal with grains, with your protein, and then with your side of vegetable, of course, keeping it as balanced as possible.
It's a lot of work for parents.
It is.
I'm just thinking through what our kids eat in a day. And, our pediatrician gave us the advice of like, instead of looking at the day, look at the whole week, which was helpful for me in giving us a little bit of leeway.
So a lot of kids are really picky eaters. I was one of them when I was young. And trying to balance getting the nutrition and nutrients they need versus what they're willing to eat is, I'm sure, a big battle for most parents. So how can you help those picky eaters without creating all of these big food battles that, parents, I don't blame them for wanting to give up?
Of course. Now that's really tricky with the picky eating specifically and like the food aversions. So the goal isn't ever to take away safe foods. Kids need calories, kids need to grow. So, the chicken nuggets, the mac and cheese, I have absolutely no problem with that. We try to, as much as we can, pair the safe foods with newer foods. So, you may start small with a vegetable that you're going to serve with the chicken nuggets, and you encourage the child, to touch it, to smell it, to lick it. And
play.
Yeah, exactly. Play with their food. And, you may have a sticker chart. And if they eventually get to tasting it, they get a sticker. So there's like motivation, especially for ADHD, where you are relying on that dopamine seeking behavior to kind of want to get that gold star, to want to get that prize for kind of playing along with this fun game.
I want a gold star. That sounds fun.
I'll give you gold stars. So.
Thanks.
There's also the Trojan horse method, which I use a lot with my son because he doesn't like onions, garlic, mushrooms, courgettes, which is zucchini. He doesn't enjoy those foods.
All the foods that I love. Okay, go on.
I want to get those foods into him, so I just blend them. I blend it into a tomato pasta sauce. I hide it. I hide it in other places, hide it in a smoothie, hide it in...
Does he know you hide it?
He doesn't know. So he's unaware that he's eating it, which again, not ideal because I want him to eventually have full acceptance of these foods.
Yeah.
At some point in the future to realize, this is what a mushroom tastes like. Mushrooms actually taste good. He hasn't made that connection yet. But in terms of just getting him those micronutrients, which is what I want to do with the onion and the garlic and the mushrooms, I'm kind of hiding it. And then I'll let him know later on, like, those turkey patties I made?
That you love?
They have, that you love. They're so tasty. That has onion and garlic and mushroom. And I can't wait for the aha moment. So you're like,
yeah,
actually, it's not sticky and gross and weird as I thought it was. So Trojan horsing food as much as you can reasonably. And yes, taking foods that they like and kind of increasing the nutritional density. So pasta is a great one. Love pasta. Pasta is a staple in our household. Put it in the fridge overnight. You will increase the concentration of resistant starches, which act like fiber. So it acts like fiber. It feeds our good gut bacteria. So in that way, you are kind of like supercharging your pasta. So now every time he gets mac and cheese, I feel good about it. I'm like, I've actually increased the fiber content of his mac and cheese. I'm feeding his good gut bacteria, which is, it's essentially like probiotic, is going to help his bodily health, his brain health in the long run. So that's kind of like how I get around the, he wants mac and cheese like on a day-to-day basis, pretty much. Chicken nuggets are fine, right? It's a protein source. Chicken contains tyrosine. Tyrosine is made into dopamine and norepinephrine. So I have nothing against the chicken nuggets. They can stay, they're allowed. What I do like to tell parents to provide less of are the candies, the sweets, the dyed foods, right? Just removing food dye from the diet is like an incredibly powerful thing to do. When we look at effect sizes, so an effect size of 0 means that this intervention I've done, no effect, no improvements. An effect size of 1 means this intervention was miraculous, like, a full 180. Just removing food dyes from a child's diet gives us an effect size of about 0.6, which is, again, you're not adding anything to the diet, you're taking something away. So that's pretty substantial. Mm-hmm. Compare that to a stimulant medication, which, for the majority, highly effective. And the effect size for a stimulant medication is like 0.8, 0.9. So when you compare that to like a 0.6, that's not looking too bad. And again, that's just removing something from the diet. So that's the one thing that I tell parents, like, I'm fine with everything else, keep everything else where it is, but just please remove the dyes from their diet. And then sugar, there's been like this back and forth in terms of, studies have shown that sugar doesn't actually worsen the core symptoms of ADHD. But I think as moms, we disagree. Like, I know with my son after birthday parties, he is off the wall, he is emotional, he is weepy, like he is a different kid with a ton of sugar in his system. But apparently that it doesn't do anything, but I disagree there. But
I anecdotally disagree with that too. I see it.
Exactly.
Because it's a thing. It is.
It is a thing. Yeah.
And it's going to happen sometimes, right? I can't lose my mind over it. He's going to go to a birthday party and he's going to have ice cream and he's going to have cake, and that's what's going to happen sometimes.
That'll be the meltdown in the car on the way home. Yep.
You're talking about mommy's meltdown, right?
Oh.
But he won't remember that. He'll remember how much fun he had.
Totally.
Right.
This is really informative.
Good. I'm glad.
Can you talk a little bit about how nutrition impacts emotional regulation and impulsivity in ADHD? And I know for me, I have the hangry condition, right? Where like I get angry when I'm hungry. So I know that there's an emotional link for me, but what do you see specifically with population that has ADHD?
Sure. So with kids who have ADHD, especially if they're busy bodies or they're just kind of the inattentiveness is there. So they're not sitting down and eating full meals because, they sit down for a few minutes, graze their dinner plate, and then they're up and about again. And they're not, spending enough time kind of consuming calories. As you mentioned, hangry, like their energy stores are going to slump. They're going to be dysregulated, emotional, because their brain doesn't have enough nutrition. There isn't enough calories in there to kind of power them through the day if they're not sitting down and focused on their food and eating a full meal. As we mentioned previously, the norepinephrine and dopamine and even serotonin as well, that conveyor belt requires input. It requires input of food. Like you need food in order to make all these different brain chemicals that help support mood, that make us feel better, that help us sleep, that help with focus and attention and, locking into homework and schoolwork. So if the nutrition is inadequate, you're running low in terms of how much output your brain is able to produce in terms of the brain chemicals that it's able to make for you. So again, it's like a double whammy. With ADHD, the levels are running low already. And then if diet is inadequate, you're pushing those levels even lower. So more dysregulation, more issues with behavior and mood.
I want more tricks like what you shared about the pasta. That kind of blew my mind. I don't know if you saw me when you were saying, I was like, because I literally, in my son's lunch today, he has old mac and cheese that was in the fridge. It was cold. And now I'm like feeling so good about myself. Give me some more easy stuff like that.
Sure. Works well for all carbs. So you can do the same with rice. You can do the same with quinoa, with other grains. You can put your bread in the fridge. Freezing also works. So fridge or freezer, it doesn't matter. Just the temperature needs to drop for that resistant starch to form.
Okay.
What else? So when we talk about depression and anxiety that might be associated with ADHD, that's because we are typically running low on serotonin, so our feel-good brain chemical. The backbone of serotonin is an amino acid called tryptophan. So fun fact about tryptophan, you can buy like tryptophan capsules in the pharmacy, but just taking tryptophan on its own isn't necessarily helpful. That's because tryptophan requires the presence of a carbohydrate in order to be fully absorbed. So, your turkey dinner with mashed potato, for example, or your hummus and pita chips, like there's method behind the madness. That there is a reason like these things are paired together. So tryptophan in the gut, when we eat food, there is this little transport protein, like a school bus almost, that takes the amino acids from our gut up to our brain so our brain can use them to form all of the brain chemicals that it needs. Tryptophan typically occurs in lower concentrations in food than other amino acids. So on this school bus, it gets like crowded out and it may not make its way up to the brain. So in order to kind of like create more space on this bus, you take your food that contains tryptophan, so your turkey or your hummus, with a side of that carbohydrate, whatever that looks like. That causes insulin to increase in the body. And then the insulin kind of forces all of the other amino acids off the bus and into the surrounding tissue, leaving more space on this school bus so that the tryptophan is actually able to take that ride up to the brain. So always have your turkey with a side of mashed potato. I don't think that's an issue for anyone. That's pretty easy to do. And then the hummus with, with carrot sticks, the hummus with pita bread, things like that.
I think that the big takeaway too is that there's so much in saying fewer carbs, don't have the starches, but really, instead of completely taking them away, just pair them with something. And that is going to give much more of a desired outcome for what their brain needs. So if your kid really likes having pita chips, getting them to have some hummus with the pita chips instead of just the pita chips is going to be great for them.
Exactly. I was always of the mind that, of all the food groups, like the most unhealthy food group, is the grains. But actually grains, they're important for childhood mental health because they provide essential nutrients that support brain function and mood regulation. They're very nutritionally dense. So they contain folate, they contain B6, B9, grains contain zinc, they contain magnesium, B3 niacin. So yeah, exactly. Instead of just throwing out the carby, grainy-based foods, to appreciate that they do play a role for us, and then to pair them with other food types to kind of really help absorption and to really boost their nutritional value. So for example, pairing grains with healthy fats. So like your avocado toast, you have your lovely fatty avocado on toast, or even just like butter on toast, for example. The fat helps us absorb fat-soluble nutrition from the grains. So from bread, you get that vitamin A, vitamin E, vitamin K when you are putting olive oil or butter or avocado on that toast.
Wow.
There's so much learning happening, and I love an episode with all the learning. It makes so much sense, and it's one of those obvious, oh yeah, well, okay, and here's some ways to do it. Because I think we always tell parents in educational therapy, like, don't do all the things all at once. You need to start somewhere.
Sure.
So what would you say, like, the biggest bang for their buck, so to speak? Like, instead of overhauling everything, like, where do they start?
So as you mentioned, small changes. It's easier to add things than to take things away. And again, I don't support taking away, safe foods for the kids, again, because we want them to have calories, we want them to grow. But take away the food dyes. Mm-hmm. Take away anything that contains red dye 40. I mean, luckily, we are going to be phasing out red dye 40, but it's going to take a couple of years, unfortunately. But we are catching up at least to the rest of the world and to Europe in that respect. So taking away artificial dyes is a really good place to start, enhancing the nutritional content of what they're already getting. So, putting those carbohydrates in the fridge to increase the fiber content, for example.
Do they need to be in the fridge for a long time?
I think it's like a 12-hour minimum.
Okay.
It's like from lunch the day before to lunch the next day. Yeah.
Yeah, everyone go put your carbs in the fridge. Okay, so what else?
What else? Parents usually come to me with already kind of a list of supplements in mind that they're interested in trying. I'd say that the three that I always start off with for ADHD specifically is magnesium. So either a magnesium glycinate or a magnesium threonate, because these two forms are able to cross the blood-brain barrier, support the brain's natural production of serotonin, of dopamine, of norepinephrine. So that's like an easy one. It helps with calming. It helps with production of GABA, which is essentially the brain's off switch. So again, has a very calming effect. So parents opt to take that in the evening, for example, if there's an ADHD present. Omega-3 is wonderful, and we don't eat enough seafood compared to, for example, the Mediterranean, obviously. So I try to encourage as much as possible, like a Mediterranean style diet, but when that isn't possible because the child has specific food aversions or just doesn't want to eat all those leafy greens, which a lot of kids do not, then supplementing with a good high quality omega-3 can be helpful. I like Nordic Naturals personally. They do a liquid, and I give this to my son, just, draw up the desired amount in a syringe, squirt it into his mouth. It's a bit oily, but it's usually strawberry or lemon flavored. And then I give him like a chaser afterwards or a small snack, kind of wash that flavor away. And he's fine with that. And very neuroprotective, very nourishing for the brain, very supportive of the brain, helps the depression, helps the anxiety. Studies have found that for the effect size for omega, it's lower than it is when you remove dyes. So the effect size for omega is about a 0.2, 0.3. Again, not zero, but small. So there's a small positive improvement for children with ADHD when you introduce omega. But again, you're not doing the omega in isolation. You're doing the omega with the other lifestyle modifications. And like all of these small things stacked on top of one another can have a big effect.
Yeah.
Right, exactly.
Yeah. We're not saying like the 0.2 is the only thing, right? Like the 0.6, that makes it 0.8 potentially, right?
Sure.
And could be more, could be less. It also depends on the person, right?
Exactly.
One thing could change everything.
Right. Yeah, based on the child, based on what's happening at home, based on their genetics, based on their diagnoses. Do they have anything else going on at the same time? Like it's so specific child to child.
Mm-hmm.
Oh, probiotics, of course. So a good multi-strain probiotic. So probiotics are actually anti-inflammatory, which really blew my mind. Like they protect the brain. They are like little fire hoses putting out all that inflammation in your body, all that inflammation in your brain. For ADHD, we do have a lot of inflammation happening, unfortunately, just due to the mitochondrial dysfunctioning happening on like a cellular level. There's a lot of reactive oxygen species being produced, and the ADHD brain struggles to kind of put out these fires on its own. So that's why it helps to eat foods that are very antioxidant high. So fruits, vegetables, omega as well, anti-inflammatory. So small things that you can do to support anti-inflammatory processes in the brain and in the body. And again, if you're taking medication, like combining the probiotics with, I think, a stimulant medication was more effective than the stimulant medication on its own. So for those kids who are taking meds, like doing all these supplements and all these additional nutritional things are going to help boost the efficacy, the effectiveness of the medication whilst helping to keep the dose of the medication lower than it otherwise would be. So those are the three. So the magnesium, the probiotics, as well as the omega. Those are the three that I typically send patients home with. And then after that, we can build on top. We can look at, B12 and other B vitamins. And if zinc is low, we can correct zinc. And, if vitamin D is low, but they're still getting a lot of sunshine, we can supplement with vitamin D. So there's a lot of pieces, a lot of steps to take.
There's a lot of nuance to all of it, but
yes,
a good place to start.
Mm-hmm.
Is there anything that you felt like you wanted to touch on that you haven't?
In terms of nutrition, no, we covered a lot of information. We talked about tips and tricks and hacks and just the importance of, as balanced a diet as possible. And as I mentioned in the beginning, vegetables are very, very helpful. Vegetables are part of that anti-inflammatory Mediterranean style diet, but they are the hardest to get kids to eat. So in instances like that, potentially talking to the pediatrician about adding, a multivitamin to kind of fill in the gaps. The lack of vegetables is potentially leaving as well.
I love this. Sara, how can our audience connect with you? Where are you licensed to practice? You already said you do telehealth, but share a little bit more about how our audience can connect with you.
Of course. So my practice is based in Beverly Hills. So the initial consultation, especially for ADHD, I like to do it in person. The follow-ups are typically virtual or in person, depending on parent preference. But you can go to my website, which is www.childkindpsychiatry.com, and there's a little contact form to reach out to me. I also have a blog site with lots of different articles on both medication as well as supplementation and nutrition options for children with ADHD, and a couple of articles for autism as well. And I'm actually holding a free workshop.
What's the website?
www.childkindpsychiatry, or one word, .com.
And the blog?
The blog is www.mommiesinmind.com.
And is mommy spelled the American way?
MOMMIES. Yeah, I had to.
Yeah.
Mummy is in mind, like Egyptian mummies. I was like, that's not going to work. So.
Yeah. And then you shared about a workshop too.
So, and through Mommies in Mind, I also host monthly workshops, typically on Facebook, where we go over medication options, non-medication options, nutrition, supplementation, brain biology, and ADHD for mothers who are wanting to learn more. You can learn more about those by signing up through my mailing list on mommiesinmind.com website.
Perfect.
Thank you.
Sarah, thank you so much.
Thank you. This is a pleasure. It was really fun. Thank you, Stephanie and Rachel.
I learned so much.
Yeah, this was great. Please say our signature sign off, which is have a great week, Smarties.
Have a great week, Smarties.
Have a great week.
Have a great week.